So first up is the Amazon Neighborhood Health Centers. So Amazon has said, look, we're going to provide near-site clinics to our Amazon employees because they just don't have good access to primary care. And that lack of access to good primary care is in large way what's driving our healthcare costs, right? So it's important to remember that you have the 80-20 rule, right? Where 80% of the claims are generated by 20% of the employees. Well, if you could get those 20% of the employees and identify them early and address their concerns early and potentially prevent a lot of these catastrophic things from happening, whether it be heart attacks or strokes or horrible cancer just because you screened them better, or musculoskeletal issues that could have been addressed through other means, whether it be through weight loss or active tissue release, etc. So Amazon's saying, we're not going to use the local healthcare system to do that anymore. We're going to provide it ourselves with our own neighborhood health centers. Now, everyone, of course, is familiar with HQ2 and how Amazon was going to have a separate headquarters outside of Seattle, and they picked Northern Virginia. Whoop-de-doo. I'm here in Dallas, Texas. We ourselves got the very first Amazon Neighborhood Health Center. That's right, it's coming to Dallas. That's where they're going to put it. Because our employer-sponsored healthcare costs, specifically in Dallas, where they have a huge distribution center by DFW Airport, our healthcare costs in Dallas are incredibly high. So if Amazon was like, well, we're going to identify a place that has a lot of opportunity because the healthcare costs for our employees are so high, then Dallas is a great place to start. Now, these neighborhood health centers are going to be, let me go to my notes here real quick. Okay, first of all, they're primary care centers that also provide musculoskeletal care, whether it be in the form of, a lot of times done active tissue release or with physical therapy as well. They're also going to provide behavioral health as well. They're also going to provide coaching as well. Behavioral health, like psychiatry services, a counselor, some people call it mental health, behavioral health, psychiatry services, whatever you want to call it. That's going to be integrated into their primary care centers that they're going to initially start with one in Irving, which is a suburb in between Dallas and Fort Worth, but they're going to have a total of 6 locations around DFW. Okay, so they're providing primary care. They're doing musculoskeletal, which is a major source of cost for employers. They're incorporating behavioral health. They're including coaching and health system navigation in this. Now, the hours of these particular facilities are going to be Monday through Saturday. They're going to be open 6 days a week from 7 a.m. until 11 p.m. because one of the major challenges for primary care is just access. And so if you have hourly Amazon employees that can either go before work or after work or on the weekends, and they don't have to worry about how they're going to fit it in with their shift work, well, that is how many other primary care clinics have those types of hours? That in and of itself is a huge quote-unquote value innovation. You want to talk about precision medicine? Well, just the timing of when the doctor can see the patient is a huge part of precision medicine. Basically, you're having the schedule of the clinic be precise. In other words, it's so broad that it's precise to the needs of the employee. And it's primary care. It's not urgent care. It's not emergency care. This is primary care. That in and of itself is worth its weight in gold. Now, they are also going to provide telemedicine. So you can say, okay, well, we can do a lot over telemedicine, but maybe you have to come in once or twice or 3 times a year. But there's so much you can do for hypertension and diabetes where you can manage that chronically over the phone or with a video visit as well. Okay, now, the other thing that they are the services that are being delivered by the Amazon Neighborhood Health Centers are not just willy-nilly chosen. Okay, they have been specifically designed and they've already been proven. And they've already been proven by the Intermountain Health System. Because what Intermountain did, because the Intermountain runs its own health insurance company, so they collect premium and they bear risk. And so they know that by having what they call third-generation patient-centered primary care, that they're going to be able to better control their healthcare costs because they're on the hook for them. They're collecting premium. Okay, what is a third-generation patient-centered medical home? Okay, first generation is, look, we're going to have diabetes educators and nutritionists. We're going to have a team-based approach for chronic disease management, okay, nurse, etc. We're not just going to have doctor-patient encounter and then we're done. We have to have a team-based approach for longitudinal management of the disease. Okay, that's generation one. Generation two is the incorporation of the mental health professional in the clinic. Because if the person is depressed or has anxiety or some other mental illness, that significantly impairs their ability to effectively manage their chronic disease. So you have to add the mental health professional into that team. That's second generation. Third generation is then health system navigation. Because believe it or not, scheduling the appointments, getting the prior authorization, fixing the bills on the back end, that's what we did at Compass. That is so complicated and so cumbersome that you can potentially decrease the quality of care if you do not address the complexity of the healthcare system itself. And so Amazon's like, hey, now I don't know if they talk to the Intermountain people or not, but they're smart people. They're like, look, Intermountain has been highly successful with this. They decreased they decreased hospitalizations by 20%. They decreased ER utilization and complex imaging like CTs and MRIs by like 30%. This Intermountain model is proven. It is not guesswork. Okay, so Amazon's going to take that model and they're going to apply that to near-site clinics in DFW for their Amazon employees. This is completely outside of a health insurance carrier plan. And it's going to be at little to no cost for the employees. So Amazon is taking this into their own hands. They're not reliant on a carrier solution for this. And this is a value-based, right? Value-based decision. Okay. Because it's not fee-for-service. It's not fee-for-service. Those doctors are going to be paid a salary. Those nurse practitioners and peers are going to be paid a salary. It's not fee-for-service. They're not going to be paid based upon how many encounters they see, right? They're going to be paid upon a salary. And Amazon is on the hook because they're bearing the risk.